Everyone. It is the day before Thanksgiving, and I'm sure everyone is getting ready to eat a lot this weekend. And so it's a little ironic that I'm talking about this today. But anyway, today I am going to talk about the way diabetes affects GYN health or gynecologic health. And November is Diabetes Awareness Month, and typically you see your primary care doctor or your internal medicine doctor, your endocrinologist, to discuss diabetes. But we are going to discuss that today in my channel because diabetes is something that I see all the time in the office, and it can affect women's health. And so I want to discuss quickly the top 3 ways in which I see diabetes the way diabetes affects women on a day-to-day basis in the office. So number 1, diabetes can really predispose you to yeast infections or vaginal infections, but particularly yeast infections. Yeast loves sugar. And so the way this commonly presents is somebody will have yeast infections over and over again. And I go through the common reasons why this may happen. I'm talking to them about, are they douching? Are they using new underwear? Are they using new soap or different scents? Do they go swimming recently? All these common questions. They're like, no. And then, treat them. They get better, and then again 3 weeks later there's another yeast infection, and 3 weeks later there's another yeast infection. And sometimes they may not have other common symptoms of diabetes, such as peeing a lot, feeling thirsty, suddenly gaining weight or losing weight. They may not have anything else. They may not even have a family history, and they may not even be obese. And so it's hard to quickly pick this out and say, you know what, I think you have diabetes. But I do screen patients who present with recurrent vaginal infections, specifically yeast infections, and I have picked up diabetes this way. Just a few months ago, I had a patient with a very similar story, and her hemoglobin A1C was 12. A normal hemoglobin A1C is around 6 to 7. So it was a huge jump, and this patient needed to be seen right away and treated right away for diabetes. So if you are somebody who has very frequent yeast infections or vaginal infections, make sure that you are being screened for diabetes and that you in fact don't have diabetes. Even if you don't have a family history, it's a simple blood test. You do not need to be fasting for it, and the hemoglobin A1C will give you your average amount of sugar in your blood over a period of 3 months. So it's a very good indicator. So make sure you talk to a gynecologist or your primary care doctor about that. Number 2, the second way in which diabetes affects GYN health is that it predisposes you to poor wound healing. So I do a lot of surgery. I do hysterectomies, ovarian cystectomies, myomectomies, whatever it is. And when I have a patient with diabetes, I specifically have to counsel them a little bit more about wound healing. Because I do minimally invasive surgery and they're very tiny incisions, often these patients do very well even if they have diabetes. But if we're doing a big open laparotomy where the patient has a bigger incision and they are staying in the hospital for 4 or 5 days, 3 days, whatever it is, they are at much higher risk for wound complications and poor healing. Similarly, this is also true in obstetrics. So patients who need a C-section, who have diabetes, are at much higher risk for wound complications or poor healing. So that's the second way in which diabetes affects GYN health. And lastly, diabetes can also increase your risk of PCOS. And we've talked about PCOS a lot on TheFibroidDoc. And if you want more information, please go back and see my IG Live with Dr. Reynolds, as well as a couple of reels that I had. But PCOS is a cluster of conditions. It's not just one particular blood test that tells you if you have PCOS or not, but it's a few different things. And diabetes, obesity, or one of them, or 2 of them. And so diabetes can definitely worsen your risk for having the condition of PCOS, which, as we know, can then predispose to obesity, cardiovascular health, poor cardiovascular health, infertility, and cardiovascular health is the number one cause of death in women. So really watching your blood sugar levels and monitoring and getting tested for diabetes is key. So just to recap, the 3 common ways that diabetes shows up in the gynecologist's office or affects women's health. Number 1, it predisposes you to yeast infections and other vaginal infections. Number 2, it can lead to poor wound healing, whether it's in a C-section or other gynecologic surgery. And number 3, it can increase your risk of PCOS, which can then lead to cardiovascular disease and infertility. So please tag a friend who could use this information. If any of this speaks to you, make sure you see your gynecologist or your primary care doctor to get evaluated for diabetes. And there are increasing numbers of women who are suffering from diabetes, and it really affects our health poorly and shaves off years from our lives. So let's take it seriously and let's get screened. All right. Hope you all have a great rest of the week. Bye.